Welcome back to part 2 of section 4. We're going to start off with stomatitis. And stomatitis is defined as inflammation of the oral mucosa, characterized by redness and some vesicular or ulcerative lesions. Glotitis is the acute or chronic inflammation of the tongue. The mouth and the tongue may appear bright red and swollen, either at the tip or the edges, or the entire glossal surface. Depending on the cause of what has caused the inflammation, the tongue may be ulcerated, such as from a niacin deficiency or a strep infection, or it can be smooth and pale, such as from iron deficiency, folate, or B12 deficiencies. Most times with stomatitis, it can be effectively treated in the outpatient setting unless there was some underlying cause that required inpatient care, such as severe dehydration that would require IV fluids. But it's important to relieve the pain and speed recovery, and primarily patients need to stop or correct behaviors that may contribute to lesion formation. This could be smoking, eating hot or spicy foods, wearing ill-fitting dentures. For these patients, baking soda or saltwater rinses 3 or 4 times a day may be beneficial. There are a variety of products out there that can help with pain associated with oral lesions, so be sure and review those on page 336. If yeast has been found in conjunction with the sores, it's important to treat for that as well. Next, we're going to talk about pharyngitis and tonsillitis, which is the inflammatory process, whether it be infectious or non-infectious, that impacts the pharynx, the tonsil, and the pharyngeal tonsils. They can occur independently, however, they often co-occur. In many cases of pharyngitis and virtually all cases of tonsillitis are contagious. Most patients present with mild to severe throat pain and the sensation of a tickle or itch in the back of the throat. Mono, the adenovirus, and group A strep tend to cause the most painful sore throats, and usually fevers are associated with them. These patients may describe their throats as feeling swollen with a lump in the back. They may present with a history of dysphagia, and this throat inflammation is common in H. flu infections, and hoarseness is often seen in C. pneumoniae infections. Most pharyngitis and tonsillitis is self-limiting and lab workup is not needed. But if there are concerns for complicated cases, and bacterial and viral cultures may be ordered. If your patient has exudative pharyngitis, then the streptococcal antigen test can be used to detect group A strep antigens and diagnose infections. Rapid strep tests are highly specific at approximately 90% and sensitive at 80 to 90% when used judiciously. Management is supportive. For allergy related forms of throat swelling, it's important to encourage the patient to avoid the environmental irritants that may have caused the condition, such as tobacco smoke. For infections, it's important for patients to limit physical activity until symptoms are improving. They need to increase their daily fluid intake to about 8 to 12 glasses of fluids daily, such as water or non-acidic juices. Throat pain can be managed with voice rest, with humidified air, nasal sprays, gargles that include hot or cold tea or warm salt water, throat lozenges, over-the-counter analgesics. If there's any concerns for the swelling of the tonsils or the adenoids that may impact airway, then referrals need to be made for surgical removal. Next, we're going to talk about epistaxis, also known as nosebleeds. And this is usually caused from a trauma or a spontaneous rupture of a superficial vessel in the nose. Know that epistaxis is a physical sign rather than a disease, and after the initial management of the bleeding, it's important to evaluate what its underlying cause may be. If there is concerns for recurrent nosebleeds, then a workup may be required. Most episodes of nosebleeds are not recurrent and an isolated event, but there are several labs that can help to determine if there's a clotting factor issue, and these would include factor 8 and factor 9 deficiencies. You may also want to do a x-ray to examine the nasal cavity and the sinuses to identify if there's any inclusion of masses, of concerns for growths, neoplasms, or any foreign bodies. Overall goals are to stop bleeding and to help manage anxiety, and for recurrent nosebleeds to evaluate any unknown causes. Treatment includes applying firm, continuous pressure for approximately 10 to 15 minutes on both sides of the nose, and continuous is the operative word here. Ice packs may help. Patients should be able to breathe through their mouth during this treatment. Patients should be seated upright with the head bent forward to reduce any vascular pressure in the area. If bleeding is difficult to stop, then the use of pharmacological agents may help. The book recommends taking a small piece of cotton or a nasal pledget soaked in a topical vasoconstricting agent such as phenylephrine or epi, and apply that to the nasal vestibule and press against the bleeding site for approximately 10 or 15 minutes. This is one time that Afrin can be very beneficial, and if sprayed with direct pressure at the affected area and pressure held, it can be very effective at stopping bleeding. If bleeding does not stop, it's important to pack the nose with gauze that has been impregnated with petroleum jelly, and pack in, and then have the bleeding issue further evaluated. If packing is required, follow up the next day is prudent to assess for any infection. If bleeding continues, then a referral may be needed to have the area cauterized. I forgot to move the slides forward, but I believe that we talked about this slide in our last section on management of it. Next, let's talk about TMJ. And TMJ is a collective term that's used to talk about disorders that impact the muscles that we use in our jaw, the masticatory muscles. These conditions can be mild, or they can progress to something that has more chronic pain and discomfort. Initial tests should be ordered to rule out if there's any underlying medical conditions. These tests may include a CBC, chemistries, SED rate, rheumatoid factor, TSH. Imaging may be x-rays to help diagnose the TMD condition. Additional testing may be ordered by a dentist, ENT, or oral surgeon. Management for temporomandibular issues are very similar to other musculoskeletal conditions. It's reduction of the pain and restoration of the joint. With these patients, there needs to be adjustment in their diets. They need to go to more softer foods. Education is very important, and also the use of oral devices if recommended by a dentist. Physical therapy may be an option, and it's to help as an adjunct treatment for other treatment modalities. On page 351 in the book, it lists medications that can be used with temporomandibular disorders, including analgesias, muscle relaxants, and tricyclic antidepressants and their use in treatment goals. Next, let's talk about dysphonia. It is also known as hoarseness and can be a common complaint, and it's described as a harshness to the quality of the voice and a low pitch. It's frequently the result of a viral infection of the larynx and is more common in individuals 18 to 40. Dysphonia is considered a cardinal sign of laryngeal cancer, which is more commonly seen in men 50 to 70. So it is important to evaluate that hoarseness in any individual, and if it does not resolve, then further evaluate. It's usually a viral process where the vocal cords become inflamed and have edema noted. If there is drainage, it's important to do a culture and sensitivity on any oral or otologic discharge. If hoarseness persists for more than 2 weeks and it is not being caused by an infection, it's important to refer to ENT, as we talked about previously, for a laryngoscopy. Education is important with these patients. Vocal hygiene and voice therapy in trying to encourage rest, good fluids, stopping smoking. It's important that these patients have humidified air, and this will help with the healing of inflamed tissues. Educate your patients on avoiding medications such as antihistamines that can have drying effects. And then there is focus on preventative measures. I think that's the end of this power deck and the end of section 4. So if you have any questions, please feel free to reach out, and thank you for your time.